What can be done when cancer has spread and chemotherapy failed? Survivability is much higher when cancer is caught early and localized because it can be totally removed. But in stage 4, when a cancer has spread or metastasized to other organs, things get complicated and the options are dangerous. Unfortunately, many patients first find out they have cancer when it already reached stage 4. Because cancer is so silent for many years, the first symptoms appear when it has already spread. This is a devastating event because one day the patient was feeling somewhat under the weather but otherwise okay, and the next, the situation was quite somber. Many find out when it's too late. Close to 90% of the patients that seek help from us come in this stage feeling hopeless because they were told that it's incurable, you are terminal, you have 3, 6, 12 months to live. But if you take chemotherapy, you may prolong your life maybe 1 or 2 years. And if these statements were not bad enough, doctors explain that there will be high probability of unpleasant side effects, and often patients experience only the side effects because chemo fails to destroy the tumor, or cancer develops resistance after an initial good response. In an attempt to get tumors to respond again, more and more aggressive chemotherapies are prescribed, but the side effects often outweigh the benefits. And a lot of doctors will then come to the conclusion that there is nothing more that can be done beyond telling the patients to get their affairs in order and seek hospice care. My message is this. First, you are not a statistic. You are a person threatened by cancer, but you have strengths and opportunities, and why not miracles? Second, advances in molecular biology have opened the door to the nuts and bolts of malignant cells' behavior, and there are some interesting and practical opportunities to better attack cancer with chemotherapy and other alternatives. These opportunities are compelling enough for me to take a second look at chemotherapy and reevaluate it from this new perspective. In order for us to recommend any therapy, it has to comply with Jesus' golden rule. Love your neighbor, in our case, your patient, as you love yourself. Most doctors will not prescribe chemotherapy to themselves, including us at the Oasis of Hope. The real challenge was to transform untreatable patients into treatable patients. Can we design a protocol with chemo that I would take? We rolled up our sleeves to meet the challenge. I tasked my research team to exploit cancer's behavior to our patients' advantage and build on the strengths of our therapies and design new protocols to enhance our success rates. The goals of our new protocols are 1. To break cancer cell barriers, and 2. Create an umbrella of protection to normal cells to avoid or minimize side effects. After years of intensive research, our team found the scientific basis for a treatment protocol we call integrative regulatory therapy, and it's so effective I would consider it for myself or give it to my beloved mother, even though it often includes chemotherapy. Our success rates confirm that we are on the right path and our patients are living longer. Though a cure is always welcome, there are other factors that are very important. Living longer with quality, be it months, years, or decades, is better than the no option. You can review the results of our prospective controlled clinical trials for stage 4 cancers of the breast, lung, ovary, colon, and rectum. The results are decidedly higher, sometimes twice as high as the National Cancer Institute's report. You can read about our success rates in our new book, Integrative Regulatory Therapy, a multifocal approach to cancer control, which can be downloaded at theoasisofhope.com. But to truly overcome the threat of cancer, you must go beyond what happens to your tumor. Even when the therapy is successful, most cancer-free patients live in constant fear that it will come back. Emotional and spiritual fortitude are essential if you want to face the future with confidence. Oasis of Hope's emotional and spiritual support is the key that brings faith, hope, and love back into a patient's life. And these 3 things are vital to abundant living. If a doctor has told you or your loved one that nothing more can be done, fear not. At the Oasis of Hope, you can face the future with confidence because here there is always something we can do for you. We are with you every step of the way using the most advanced and creative clinical strategies available. We are here to give you the resources necessary to really live out your life, however long, to the fullest. God bless you.